Good afternoon. I am Dora Merritt-Mitchell. I'm the Executive Director of Guardianship and Trust Corporation. I have here with me Gina Clark, who is kind of a newer employee at Guardianship and Trust. So although she and I kind of co-wrote the grant, I'm going to talk about GTC because I'm most familiar. Guardianship and Trust was founded in 1981. We are kind of a baby of the Arc of Tennessee. The parents kind of got together and decided or thought about that what they could do to improve their children's lives once they've gone on, and who might be a good person or a good place where they could look for that to happen. Once that started to evolve, then Guardianship and Trust began to take on more things. So we are a trust company, but we also are a conservatorship company. So we take on conservatorship and guardianships by court appointment. So any person who is deemed incompetent by the court, we deal with Davidson County and counties surrounding Davidson County, to need someone to help them with their medical, financial, any decision making, any healthcare decisions, nursing homes. I mean, it's kind of like we're their parent and they've become the child. And we try to do things in the way that we, as best we can tell, that they would have wanted them done. So if they're able to be maintained in their home, then we try to do that if they have the financials to do that. If not, then we place them and then we make sure that they have everything that they need, insurance, things of that nature, any benefits that's to them, any Medicare, anything that could be used to assist them with their long-term care. We are on call 24 hours. So we're available if we have to, and we've had to before, go to the hospitals to make medical decisions in the middle of the night, on weekends, holidays, so forth, so on. Many of our wards don't have anyone. And then there are some situations where there is family, but the family's more concerned if there's finances. Seems to be more like they're worried about the monies as opposed to how mom, dad, aunt, or uncle, are going to live, or who's taking care of them, making sure there's food, making sure that they have clean water to drink. I mean, we've been in some serious situations. Usually Adult Protective Service is who reaches out to Guardianship and Trust. There's a case, and they've deemed the person incompetent, whether it be an anonymous phone call or a doctor's office calling, where they're concerned about the person going home and being alone with no one to assist them. So when that happens, then they contact us and ask us if we have room to take them. We take clients that have no money, which is why we write grants. Usually there's just enough money to take care of their care. And then, of course, we have to then pay the employees to do the work for them. Guardianship and Trust is a very small agency. We have 4 full-time employees and 2 part-time attorneys. The attorneys are there in case there's some legal concern that the persons may have. We've had wards where we've had some slip and fall situations, and we've had to sue on their behalf to get the monies, and so that person then who was indigent now has millions of dollars because we fought for them for things like that. I've been at Guardianship and Trust for 20 years. Now, I started pretty much fresh out of college as the social worker. I'm the only social worker on staff. So I do a lot of running around as well as being the executive director to keep things floating. We're just a great agency. I mean, I've been there. I think I'm stuck there. I feel like, even though I'm worn out on most days, that by the time I get home, I've made a difference in someone's life. So at the end of the day, it's a great feeling. I'm not sure where I am on my time, but if you have any questions.
Can you address specifically what this money would go for? What this funding?
This funding will go for helping, again, take care of the clients. I mean, it doesn't go towards the clients. We're going to use it to pay salaries. But again, each ward, generally when we first get a ward, that's when it's the most hands-on. That's pretty much everybody hands on deck, has something to do in the office in regards to that ward to make sure we've investigated everything. And it we've estimated that it takes somewhere when we first get the award in the first year, somewhere between $6,000 and $8,000 of staff time where we've just kind of jumped in, hands on deck, and that's typically a ward that's found in the community. If we become a conservator of a ward who is in a nursing home or in a different type of setting, then pretty much their needs have been met, and so then that's not as much hands on deck. Then everybody has to jump in. So we're looking to use some money to fund so that we can keep everybody working, so that we can continue to do the work that we do.